Yeah. So for that first group, the young adults who are getting treatment that's more akin to pediatrics, like they're coming in quite a lot because we're giving them very, very high doses of chemotherapy, sometimes over the course of several days. For example, for Ewing sarcoma, and I've actually written about sort of the time toxicity of like how much time they actually have to spend with us is like a huge part of their journey, even for when we're trying to cure them of their Ewing sarcoma. And so it can be over, cycles every 2 weeks. So, and then those treatment cycles can be like either 2 days or 5 days, depending on the cycle. And oftentimes because of the chemotherapies we're using, we need a lot of hydration. We need to give them medicines to counteract the chemotherapy. So they're here for 12 or 13-hour days. If that's not doable, sometimes they have to be admitted to the hospital for those 5 days for monitoring. And so it can be a lot of time. And then between those visits, there's always complications. For example, a lot of chemotherapies drop people's blood counts and it put them at risk for infection. And so if they have an infection, we have to admit them again to the hospital. And that's a lot of time again in the hospital setting. And sometimes they have to get extra treatment for nausea and diarrhea and fluids. And so we're seeing them also between those visits. And most of the regimens we use for kids end up being, between 7 and 9 months of treatment. So it's a long time. Part of that journey is usually radiation or surgery, depending on the situation, which is again, like, for example, radiation, you're coming 5 days a week for, 5 to 6 weeks. So we ask a lot of our young adults in terms of time, and it's time when, our goal is to cure them of their cancer, but the amount of time that we ask of them can make it hard for them to advance their career and future going forward.